Very good afternoon, everyone. So, we'll discuss today's topic, which is personality. You can't hear me? Is there anything over there? Very good afternoon. So, let us move forward with today's class, which is personality. We'll be covering it under the following heading: meaning, definition, classification, measurement, alteration, and most importantly, what is your role? No problem if I am not audible. Please pay attention towards the slide. Everything is written in the slide. Please move on to the next slide. Okay. So personality is the term which is derived from the term persona. So in older time, the persona was the term given to the actors who used to wear certain kind of mask over their face to express themselves when performing in a stage. So from there, the term personality came into begin. And in modern psychology and literary context, it refers to the social face or identity an individual presents to the world. Next, there are certain hereditary and environmental factors, certain cultural factors and social factors associated with personality. And personality also keeps changing itself based on environmental and social context. Over the course of time, various definitions of the personalities have been given. So let us move towards each and every definition and find out what does it mean. First of all, Walter Mischel was one of the psychologists who says that personality consists of distinctive pattern of behavior which include thoughts and emotion that characterizes each individual's adaptation to the situation of his or her life. So what is your thought process? How do you process your emotions in day-to-day life? How do you react to certain situation is what constitute your personality. Then very important is Sigmund Freud, who is the pioneer in the term of psychology when you talk about psychology and psychiatry. He says that personality is seen as a result of unconscious drives and conflicts between different parts of the mind. So he has divided human brain into three parts: id, ego and superego. Id is the lowermost part of the human brain or human conscience, which is like responsible for basic things. Khana hai, sona hai, responsible for sexual activities, etc. Then is your superego. When you talk about superego, it is very moralistic thing. Everything should be right, or if it is right, it is right. If it is wrong, it is wrong. Ego is something which comes in between and it keeps the balance between id and superego. Getting it? So when we talk about ki person is egoistic in a layman term, it is not what exactly the term ego defines. Next, according to American Psychiatric Association, personality refers to deeply ingrained pattern of behavior, which include the way one relates to, perceives, and thinks about environment and oneself. Similar to what we have studied earlier as well, the environmental and socio-cultural factors are responsible for how your personality is defined. Then again, Watson was another psychologist who said that personality is shaped by learned behavior that result from an individual's interaction with the environment. He believed that all behaviors, including those that make up personality, are learned through conditioning and reinforcement. How you, if suppose you learn how to behave in a particular situation, whether the behavior is in a positive way or in a negative way, is something which is enforced in your personality. So this is something is going to happen in future directions also. So what you learn right from your childhood, what you learn from your environment is something which is going to contribute to how you're going to behave under certain situation when you grow up into an adult. Getting it? Next, we'll move on to the classification of personality. There are several types of classification. Just to name a few, Hippocrates gave one classification. Another was given by Cashmers, Sheldons, Carl Jung, Alport, and type A and type B personality. We'll see each and every one by one. First of all, we're talking about Hippocrates classification. So what does Hippocrates said? He divided human body fluid into four types. Based on those characteristic and color of the fluid, human personality was decided. For example, he said choleric or yellow bile fluid. So people with more of a choleric trait or choleric fluid in their body are more determined, they are quick to act, they are fierce, they are passionate and energetic. Next, sanguine or the blood type. So as you all can see, blood type where they will be warm-hearted, outgoing, optimistic, cheerful. Then phlegmatic is phlegm. What is phlegm? Okay, find out what is phlegm. Okay, it is a very common term. So these patients are quite calm, slow, shy, rational and consistent. Then there is melancholic, that is black color. As the color signifies, these patients will be anxious, depressed. So this is how the Hippocrates classification was decided, but it was definitely ignored in future terms. Next is Cashmere's classification. Cashmere's and Sheldon, which we'll see after this, they are quite similar. So they divided personality on basis based on the basis of body type. So they said there are three body type. One is picnic, another is athletic, and third one is asthenic. Picnic are the people who have more fat type and less muscle mass. So they will have more of a round body structure. So these people are said to be more socially acceptable people. They are more helping to other, very warm people. Then talking about athletic people who have more muscle mass. So they are healthy and sorry, they are somewhat between picnic and asthenic. Sorry. So they are energetic, optimistic, and adjust to any situation. Then asthenic are the one who are very thin, lean, and tall. So they are said to be very socially shy people, very pessimistic people. Even in certain condition, it was believed that picnic type was more associated with bipolar or mood disorder in psychiatric illnesses, whereas asthenic type was more associated with schizophrenia or psychotic illnesses. Next, Sheldon also gave the similar classification, but he called the body type endomorph, mesomorph, and ectomorph. Okay, just you can see the pictures. Please change the one. Okay, endomorph, mesomorph, and ectomorph. Next, we have Carl Jung classification. This is something which I guess all of you know. He divided actually two class of people, introverts and extroverts. Ambiverts are someone which are between them. Introverts, again, they are someone who are self-centered, who do not like to go out much, who do not like to, talk much to the people outside. Whereas extroverts are very outgoing, they are social, realistic. So it is also said introverts are people who could be a better writer. They can, concise their thoughts into writing, whereas extroverts are very, very good leader, very good people who give speeches and everything. Okay. Then Alport's classification has classified the personality into two types, ascendants and descendants. Again, ascendants are the people who are more of dominant and outgoing, whereas descendants, as you can see the picture, they are more submissive. They are following the rules, regulations, they are keeping it to themselves. So the core point in all these classification is that behave based on their, some say body type, some say how they behave in a social situation, their personality is being defined. Next is type A and type B personality. Okay, here I would like to emphasize on the fact that there is also a term called cluster A and cluster B personality, which comes under personality disorder. Do not get confused between these two. All right. So type A personality people are highly self-driven, ambitious, goal-oriented. They are always on the go. So in these people, there are chances कि ये लोग stressed out जल्दी हो जाते हैं. So they are more prone to, stress and motivated by challenges. Next, in contradicting to type A, type B personality are more focused type, but they learn how to enjoy their life by going in a slow pace as well. They have high life satisfaction, they are fun loving, easygoing and people oriented, and they are less prone to develop any stress related symptoms. Okay, this is what I was taking to DSM-4 or DSM-5, and ICD classified personality disorder into certain characteristics. Cluster A consists of paranoid and schizoid personality. Cluster B consists of emotionally unstable, impulsive and borderline and histrionic personality. Cluster C, anxious, dependent and anarchistic personality. Now next thing is measurement and evaluation of personalities. Just a brief introduction. What is important for nursing, from nursing point of view is, you people are going to spend maximum number of minutes or hours with the patient once the patient is admitted. So you will have ample amount of time to observe how people are behaving, how they are reacting to certain situation, how they are following the orders, and how they are treating their family members or the co-patients which are with them. So this will give you a better idea of understanding personalities. So it is helpful for individual to assess his or her own personality and can better understand himself and others. Personality understanding can also help you to choose your career path in a very correct way. And it also helps in defining the clinical diagnosis and psychological intervention. So how do you measure personality? Please next slide, Sudhi. So either by interview method, by observation method, by certain inventories, of projective techniques and situational tests. So we'll see one by one. Interview method, as you all know, what is an interview? Can anyone tell me what is an interview? What is an interview? Okay. So when somebody asks you certain questions, maybe it may be related to your job profile, it may be related to your academic something. So how do you interview? But in talking from the point of view of medicine, how do you interview a patient is something very important. All right. So, but we are talking about personality assessment. Interview method can be two types, structured or unstructured. So what happen in structured interview, you will already have a predetermined questions ka list. So you'll answer you'll give it to the people, they'll answer. Suppose I want to interview the class of 100 people currently. So I'll give you that structured list, you will answer, each answer will have a specific, each question will have a specific answer, and based on that we can have a more or less some idea about how each person is thinking or behaving. All right. These interviews are used to select employees for job. Again, unstructured is something which is open-ended. We'll sit one by one and we'll ask you to tell something about yourself. You will have ample amount of time to talk. Got it? Interviewer knows about his interests, problems, strength, and limitation. So merit are that it is highly flexible and can be used for a variety of population. And while interviewing unstructured type, we can also see सामने वाला का person का body language कैसा है, how is he facially behaving, what is his speech when he's talking about. Then demerits, it's very time consuming, and you will require a very trained official to conduct the interview. Then observation method, it involves the observation and recording of activities of a person by the observer in a controlled or natural situation. It is little difficult to understand in a way that you will require some kind of device to record the interview or record the process by which the person is behaving. It will take near about 5-6 days or maybe a week to come to a conclusion if you are giving certain hypothetical situation to the person, how he is behaving, or in a natural or a controlled environment, how he is behaving. All right. Later rating scales are used to rate various personality traits. So it is one of the simplest method of data collection. One important thing, like you want to assess how children are behaving in a particular environment, it is important for them. If a person is mute, deaf and dumb, you can apply this method for them. All right. Again, it will be time consuming, and there will be faulty perception, personal bias on the basis of observer. ओके इम्पॉर्टेंट थिंग जो कि साइकोलॉजी में सबसे ज्यादा यूज होता है, पर्सनालिटी इन्वेंट्रीज. सो बेसिकली it is a printed form containing statements, question or adjective which apply to human behavior. So their examples are MMPI, 16 PF personality factors and Bell adjustment inventory. So इसमें क्या होता है, फॉर एग्जांपल MMPI जो है आपका 500 प्लस क्वेश्चंस होते हैं, उसमें आपका कोई ये नहीं होता है कि राइट और रॉन्ग आंसर नहीं है, यस और नो बेसिस पे होता है. यू विल टेक द आंसर एंड एसोसिएटेड आंसर, उसका जो आंसर शीट होता है वो साइकोलॉजिस्ट के पास होता है, एंड बेस्ड ऑन द आंसर टाइप उसमें ग्राफ बेसिस पे बना सकते हो, प्लॉट्स कर सकते हो, उसके अकॉर्डिंग पर्सनालिटी किस डायरेक्शन में जा रही है इस पे कमेंट किया जा सकता है. अगेन इसके लिए आपको क्वालिफाइड इंस्ट्रक्टर या क्वालिफाइड इंटरव्यूअर चाहिए होगा. गेटिंग इट? So individual provides information by responding to question statements in the inventory. Responses are scored in quantitative terms and interpreted on the basis of norms that are developed for the test. All right. This just an example कि अगर हम MMPI की बात करें, कुछ क्वेश्चन होंगे कि यस और नो बेसिस में क्वेश्चन है, और सर्टेन नंबर ऑफ क्वेश्चन हैं जो कि डिफाइन करेंगे सर्टेन कैरेक्टरिस्टिक ट्रेट्स ऑफ द पेशेंट। जैसे कि एग्जांपल आप देख सकते हो, डिप्रेशन, आपके कुछ क्वेश्चन डिप्रेशन से रिलेटेड होंगे, कुछ पैरानोया से रिलेटेड होंगे, कुछ हाइपोमेनिया से रिलेटेड होंगे। So these will be this scale will be used to come to a formulative diagnosis. Again, less time consuming and easy to administer, more reliable. Close question can be compared. It is used for counseling and research purpose. Again, demerits, गलत आंसर भी दे सकता है इंसान। वो कुछ लोगों को पता ही नहीं होगा कि हमारे पर्सनालिटी ट्रेट कैसे हैं। They can fake the answers as well. So although there are प्रोविजन इन दिस टेस्ट की जब फेक आंसर कर रहा है इंडिविजुअल, उसका भी पता कर चल जाता है, बट अगेन यू विल रिक्वायर अ हाईली क्वालिफाइड पर्सन फॉर दैट। नाउ इंपॉर्टेंट थिंग, प्रोजेक्टिव टेस्ट, जो आप लोगों को थोड़ा बहुत पता होगा। सबसे पहले रोशाक इंक ब्लॉट टेस्ट। सो ये सबने देखी है ये पिक्चर? आप लोगों को पता है पिक्चर क्या है? कुछ आइडिया? नो? ओके ओके। सो व्हाट हैपन इन रोशाक इंक ब्लॉट टेस्ट, you have 10 cards. Please be quiet. You will have 10 cards. Each and every card will have some answer. मतलब पिक्चर है, so you will have to answer whatever is coming to your mind उसके according. ठीक है? जो whatever you will answer, that will be written as the answer, and based on your responses, we'll check it against the set of answers which are provided to us. So we'll come to the conclusion. So 10 cards are there. 5 cards are black and white, 2 are red and white, and 3 are multicolored. Subject statement regarding what is seen in the card yield information about the personality. जैसे पहले 3 कार्ड जो हैं वो ब्लैक एंड व्हाइट होंगे, 2 इसमें रेड एंड व्हाइट बना नहीं है, रेड एंड व्हाइट होते हैं बाकी के। ठीक है, पहले 5 ब्लैक एंड व्हाइट होंगे। सो पहला वाला कार्ड अगर देखेंगे तो पॉपुलर रिस्पॉन्सेज आर बैड, बटरफ्लाई, मोथ, किसी को अब देख के बटरफ्लाई लग रहा है, किसी को कुछ लग रहा है, समझ रहे? तो दीज आर द थिंग। जैसे आप कार्ड 3 की बात करेंगे, उसमें लोग बोलते हैं कि 2 ह्यूमन हैं, जो 2 ह्यूमन फिगर है, कुछ पकड़ रहे हैं, हैंड टच हो रहा है, तो ऐसा कुछ दिख रहा है। ठीक है, सो दिस इज जस्ट अ एग्जांपल ऑफ दैट। Next is thematic apperception test or TAT. So what happens, we will show the person, कोई ambiguous picture दिखाएंगे, इस picture के basis पे आप लोगों को बोलेंगे कोई story बनाओ। ठीक है, you'll have to formulate a story based on this picture. So what will be the constituent of that story will define कि आपके personality traits क्या हैं। Theme in the stories can involve conflict, affection, fear, contentment or achievement. Got it? नेक्स्ट इज वर्ड एसोसिएशन। सिंपल है, इंटरव्यूअर बोलेगा, एक वर्ड देगा और आपसे पूछेगा उस वर्ड से, मतलब आपको उस वर्ड को सुनने के बाद क्या दिमाग में आ रहा है, यू आंसर दैट। ठीक है, एग्जामिनर अटर्स अ सीरीज ऑफ वर्ड्स वन एट अ टाइम एंड द सब्जेक्ट अटर्स द फर्स्ट वर्ड दैट कम्स टू हिज और हर माइंड। एग्जामिनर रिकॉर्ड्स द रिप्लाई, रिएक्शन टाइम एंड एनी अनयूजुअल बिहेवियर या स्पीच इस शब्द को सुन के कुछ मिला है कि नहीं है। ठीक है, then sentence completion is also somehow similar to previous one. इसमें आपको एक sentence दिया जाएगा, आधा अधूरा बोला जाएगा, बोलेगा आप इसको complete करो। Number of incomplete sentences are given and the subject is required to complete them. Responses are analyzed for indication of one's personality. Okay. Okay, this is also similar to previous tests which we have done. We will be given some real life situation where you will be asked to perform certain activities. आपको कोई hypothetical situation दे दी जाएगी, पूछा जाएगा कि इस situation में आप कैसे act करोगे। आपके morals पे, आपकी belief पे आपका आंसर डिपेंड करेगा। ऐसा नहीं है कि कोई आंसर सही है, कोई गलत है। जो आप सोचोगे, आपके पर्सनैलिटी ट्रेट उसके अकॉर्डिंग इवेल्युएट किए जाएंगे। Subject's behavior is analyzed by trained judges. It is also used to assess communication skills, interpersonal skills and teamwork. All right, clear? Okay. Alteration in personality. Since you all will be working in a medical field, hospital में काम करेंगे, तो वहाँ पे आपको बीमार लोग दिखेंगे, any kind of illness, चाहे वो physical illness है या psychiatric illness है। Based on that आपको evaluate करना है। वेरी इंपॉर्टेंट कि ऐसा नहीं है कि आप लोग को बच्चा ही मिल रहा है कि एडल्ट ही मिल रहा है, कोई भी पेशेंट मिल सकता है और हर किसी इंसान का एज के अकॉर्डिंग, पर्सन टू पर्सन के अकॉर्डिंग, जेंडर के अकॉर्डिंग बिहेवियर अलग होगा। इलनेस और कोई इलनेस है तो इट कैन इम्पेयर पेशेंट्स फिजिकल, इमोशनल, सोशल एंड इंटेलेक्चुअल फंक्शनिंग। Alteration in personality can occur due to any illness or because of any personality disorder as well. So, अगर illness है तो क्या personality changes हैं? Withdrawn behavior. स्पेशली अगर कोई लॉन्ग टर्म से इलनेस है तो पेशेंट का मन ही नहीं करेगा वो किसी से बात करे, वो अपने तक ही रहना कोशिश करेगा. He would not like to interact with anyone. They avoid interaction. They resort to solitary activities. It may illness को क्या क्या करती है, आपको एक जो सेंस ऑफ सिक्योरिटी अपने लिए होता है वो कम डाउन कर देती है, आपको बहुत वीक फील होता है. तो दिस इज द बिहेवियर विच सिग्निफाइज दैट. सो यू हैव टू अंडरस्टैंड why the person is behaving like that. Okay. Then there are certain illness which are associated with the body disfigurement. किसी का सपोज हाथ कट गया है, किसी को एसिड बर्न हो गया है, तो उस टाइम पे भी सेल्फ इमेज और सेल्फ कंसेप्ट इज वेरी मच डिस्टर्ब. गेटिंग इट? Physical appearance can cause self esteem and self concept disfigurement. Patient may no longer meet the family expectation and this can further lead to tension and conflicts. Again, सेल्फ सेंटर्डनेस मतलब क्या होता है, कोई बताएगा? अंग्रेजी में क्या मतलब होता होगा सेल्फ सेंटर्डनेस? वेरी गुड. ठीक है, यू टॉकिंग थिंकिंग अबाउट योरसेल्फ ओनली. बहुत बार जब पेशेंट बीमार होता है ना तो ही इज लाइक कि अपने बारे में ही सोचना रहता है कि मेरे साथ ऐसा हो गया, अब मुझे लोग अटेंशन दे, मेरा ये काम जल्दी हो जाना चाहिए, मेरी बीमारी जल्दी ठीक हो जानी चाहिए. सो सो द पर्सन एक्सपीरियंस इलनेस टू पर्सनली. The threat possessed by illness makes patient preoccupied with himself and his health. Less attention is paid to the outside words and the concern of another. And इससे क्या होगा, उसका जो रिकवरी प्रोसेस होता है ना वो भी हैम्पर होता है, वो अपनी चलाने लगता है. Getting it? Again is demanding and dependent behavior. बहुत बार बच्चों की तरह बिहेव करने लगते हैं when patients are quite sick for a long period of time. They may be highly demanding and excessively dependent on others. They at time may be afraid of taking treatment and react timidly. All right. They can become non-cooperative and reluctance towards healthcare. This is something जो आप लोगों को मिलेगा देखने को. Patient कहेगा अभी मुझे इंजेक्शन नहीं लगवाना है, अभी मेरे को ये दवाई नहीं खानी है. So understand why patient is behaving like that. At times आप लोग उसको प्यार से भी समझाओगे तो वो समझ जाता है. At time आप आधे घंटे का लेट भी कर लोगे तो कोई बात नहीं, ठीक है, तब तक पेशेंट थोड़ा शांत हो जाए. You tired? Some patient may show reluctance towards healthcare. They may not follow advice of healthcare professional or caregiver. This labeled as non-compliant. They do not take medicine as prescribed. Sometimes patient may get aggressive. Hostile यानी कि aggressive हो जाएगा. Why? Because वो खुद की feelings को कैसे express करे, वो गुस्सा है, अंदर से helpless feel कर रहा है, तो this is outwardly वो उसको as an aggression portray करेगा. Getting it? समटाइम्स शेम एंड गिल्ट. कुछ बीमारियां होती हैं जो पेशेंट को लगता है कि मुझे ऐसी बीमारी क्यों हो गई, खास करके HIV एड्स है या हमारी मेंटल इलनेसेस हैं. ठीक है, तो बहुत ज्यादा सोसाइटी का उसकी तरफ क्या रवैया है, हाउ फैमिली मेंबर्स आर डीलिंग इट, हाउ स्टिग्मा आर एसोसिएटेड विद सर्टेन इलनेस. दीज इलनेसेस causes a feeling of shame in the people. So this might cause some guilt feeling and shame feeling in the patient. All right, and they damage the concept of self. Again, based on personality disorder, this will not go in detail. Paranoid schizoid personality होती है. इसमें क्या होगा कि paranoid schizoid में मोटा मोटा you understand patient are confined to self. लोगों पे थोड़ा शक वहम जैसे ज्यादा जल्दी करना पड़ेगा, अपनी दुनिया में रहेगा. Getting it? Then antisocial is someone not following the rules and regulation. Histrionic narcissistic borderline, आपको मैंने cluster B जो समझाया था कि borderline people या तो A है या फिर B है, ये right या wrong वाली चीज है. नार्सिसिस्टिक अगेन वेरी मच अपनी चलाने वाले लोग होते हैं. हिस्ट्रोनिक जिनको व्हाट कैन आई, राखी सावंत इज अ वेरी गुड एग्जांपल. ओके. देन यू हैव एंग्शियस डिपेंडेंट एंड एनकास्टिक पर्सनालिटी. दिस इज बेसिकली जो कि एंजाइटी प्रोन पीपल होंगे या OCPD जिनको ऑब्सेसिव कंपल्सिव डिजीज के ट्रेट्स होंगे उनमें देखने को मिलते हैं. Now very important role of nurse in identification of altered personality and improvement in altered personality. Identification is something जो कि आपने अभी illness वाले में देखा कि how personality behavior are changing. So this is something you can apply in your daily life as well. अपने घर वालों पे, अपने दोस्तों पे भी apply कर सकते हो कि he or she is behaving in certain way, तो उसकी कुछ personality traits कैसे होंगे. Then very important, you should help patient express your thoughts and feelings. Provide care that helps patient effectively cope with the changes. बहुत बार पेशेंट हॉस्पिटल इज अ वेरी न्यू थिंग टू देम. अगर हम में से भी कोई एडमिट होगा हॉस्पिटल में तो हम भी थोड़ा हकबका से जाएंगे कि कहाँ नई जगह आ गए हैं. स्पेशली उसके बाद आपके इन्वेस्टिगेशन हो रहे हैं, ब्लड प्रोसीजर हो रहे हैं, तो यू ऑल विल गेट लिटिल कंफ्यूज. ठीक है, सो इन दिस केस मेक पेशेंट कंफर्टेबल, एक्सप्लेन टू देम इन अ वेरी क्लियर एंड सिंपल लैंग्वेज कि क्या प्रोसीजर होने वाला है, हॉस्पिटल में कैसे चीजें चलती है. बी वार्म एंड रीअश्योरिंग इन योर मैनर्स. Spend time with withdrawn patients so as to increase their self-worth, and maybe explore why are they anxious. Be clear and consistent in communication. Be ready for the care of the patient, and very important is negative feelings of the patient should be replaced by feeling of hope, courage and willingness to cooperate. Many a time आपको लगेगा पेशेंट अचानक से क्वेरल करने लग जा रहा है, तो आप लोगों को वहाँ पे थोड़ा सा एक बफर की तरह भी काम करना पड़ेगा. अगर पेशेंट गुस्सा हो रहा है, दो पेशेंट की आपस में लड़ाई हो रही है, तो ठीक है आप उनका बेड चेंज कर लीजिए, उनके साथ बैठ के थोड़ी देर बात कर लीजिए. तो दिस कैन हेल्प यू काम डाउन द पेशेंट एंड help dissolve an aggressive situation at the end itself. Healthy personal relationships such as confidence and cooperation with the patient should be built. Encourage the patient to participate in recreational activities either individually or in group. Help patient in verbalizing their feeling. बहुत बार ऐसा होता है, not just patient, your colleagues, your fellow beings, your friends, you might feel anxious but you do not know what anxiety is. आपको बहुत दुख हो रहा है लेकिन आपको समझ में नहीं आ रहा है कि दुख क्यों हो रहा है, या दुख भी हो रहा है कि क्यों हो रहा है, आप बस परेशान हो. Let them acknowledge that thing and let them express this thing. Getting it? It helps subside anxiety and reduce problem behavior. So to conclude, an understanding personality of a nurse will help to help her predict the behavior of others very well. It will help you as a nurse also कि successful career कैसे बनाना है. अच्छी personality होगी, you will अपने अंदर भी incorporate करनी है और दूसरों को भी समझना है. Getting it? A nurse deal with patient from different age group and personalities, so being aware of one's personality can change the approach and behavior how you are dealing the patient. All right, any questions? Done. So this Shri Vani जो book है वो आप लोगों की psychology की book है. So lecture is maximum part is taken from that lecture, कुछ from that book, बाकी चीजें और जगह से ली गई है. चलो, thank you. चलो.